So we'll begin with Professor Praveen VASHIST from AIMS RP Center, Dr. RP Center, Delhi, who will talk on global epidemic of diabetic retinopathy. Praveen did a wonderful work actually in India, doing a larger survey of most Indian states to find out the status of both DM and DR. So nobody can be more eligible than Praveen talking about the DR status in India and global. Praveen, up to you.
Thank you so much, sir. In fact, I am really grateful to sir for giving me an opportunity to present this topic. I'll be talking about global epidemiology of diabetic retinopathy and with specific emphasis on India. In fact, if we specifically talk about diabetes mellitus, so currently the prevalence of diabetes is considered around 10.5% globally. That means we are nearly 537 million diabetic globally. And 44.7% of these remain undiagnosed. Beside this, nearly equal number, 10.6%, 541 million, are pre-diabetic with impaired glucose tolerance. And diabetes-related death globally are nearly 6.7. We see the prevalence is higher in higher age group, up to 79. But when we see the projection by IDF, from the current number of 537 million, we go to 643 million 2030. And by 2045, the number is estimated to be around 783 million. And 3 out of 4 adults with diabetes, they live in low and middle income countries. If you see the projections of diabetes by 2045, the maximum number is in Africa. It will increase to 134% by the year 2045. And after that, it is basically in Asian countries and Middle East countries. Specifically, if talk about India, as per the India App study, the prevalence of diabetes, national prevalence is 11.4%, and the total number around 101 million diabetics. In fact, I remember 10 years ago, we were saying that by the year 2030, we'll reach to 80 million, but we are already 101 million. That is very high number in India. And beside this, much more number, nearly 15.3% are pre-diabetic, which account to 136 million. For diabetic retinopathy, I'm quoting this recent published paper, the systematic review on meta-analysis, which was published in 2021. The diabetic retinopathy prevalence globally is taken as 22.27% among the diabetics, which is responsible for nearly 103 million diabetic retinopathy cases. The vision-threatening DR is 6.17%, and macular edema is 4.07%. The estimates for 2045, so diabetic retinopathy will be 160 million, vision-threatening DR will be 44 million, and CSME will be around 28 million. Again, if we talk about the prevalence, the current prevalence is highest in African countries, is around 35.9%, and in North American and Caribbean countries, 33.3%. Maybe the number may be highest in Western Pacific and Asian region. The prevalence is highest in African and North American regions, and lowest prevalence is in South and Central America. The prevalence of diabetic retinopathy in India, in fact, we have national survey figures, which was conducted from 2015 to 19. And as per this survey, prevalence of DR is 16.9%, and prevalence of STDR is 3.6%. We have another smart study, which shows the 12.5% lower prevalence, but STDR is slightly higher, it is 4%. That means in nearly 101 million population in India with diabetes, nearly 4 million people, they have vision-threatening or sight-threatening diabetic retinopathy. Then another systematic review conducted by T.P. Das sir, and we have all the major studies in this systematic review. And as per this, the prevalence of diabetic retinopathy is around 16.1% in the country. Whereas if we talk about DR in overall population, it is 1.63%. So 16.3% among the diabetics and 1.63% overall population is the prevalence of diabetic retinopathy. They have done various subgroup analysis, and this shows there is some increase in rural population, though the overall burden is higher in urban population, but there is narrowing of gap between urban and rural age groups. The side-threatening DR as per this meta-analysis is 4.5%, slightly higher side, and diabetic macular edema is 2.1%. So compared to other countries globally, it is lower. So I will speak about the national survey, which we conducted from 2015 to 19. The prevalence of diabetes in 50 plus age group was 11.83%, and nearly 1/3 of diabetic was unknown in that population. If you see age and gender-wise distribution, it was slightly higher among males, but almost equal, the prevalence of diabetic retinopathy. It was less in 50 to 59 age group, but higher in older age group. But probably the most important finding which we get is 90%, 89.9% of diabetic patients in India, they are not getting their retina examined. So you can understand what the status of actually coverage of diabetic retinopathy patient being seen by the eye ophthalmologist. The glycemic control is also poor. Near 60% of patients, they have poor glycemic control. Just 40% they have good glycemic control. If we see in various districts, the prevalence of diabetes and also diabetic retinopathy is much higher in southern India compared to northern Indian states. Again, the STDR also is ranging from 0% to 6.2% is again higher in South Indian states. But when we talk about blindness and MSVI due to DR, the proportion is much less. Out of the total blindness, just 1.2% of blindness is attributed to diabetic retinopathy. And if we see MSVI, it is just 0.7% of MSVI in India is attributed to diabetic retinopathy. If we talk about the various risk factors for diabetic retinopathy, probably the most important risk factors are the duration of diabetes, poor control of diabetes, pregnancy, hypertension, nephropathy, and a combination of factors like hyperlipidemia, smoking, cataract surgery, obesity, and anemia. Among them, the modifiable factors are blood glucose, blood pressure, blood lipids, body mass index, and smoking. What I want to show here that higher the duration of diabetes, higher the chances of having diabetic retinopathy in the country. Just to summarize, as far as diabetes is concerned, the total number is 537 million, and it's 1/3 of number is in the Western Pacific region. Expected number is estimated as 783 million by the 2045, and maximum increase is expected in African countries. India has already crossed 100 million diabetics. The prevalence of diabetic retinopathy globally is 22.3%, and vision-threatening DR is 6.2%. Highest prevalence currently is in Africa. DR in India is 16.9%. And duration of diabetes and uncontrolled diabetes are the risk factors, major risk factors for diabetic retinopathy. Thank you very much.